First question. Which of the following is true about pronephros? Option A, it is represented by 7 to 10 solid cell groups in the thoracic region. B, first seen late in the 3rd week and completely degenerates by the start of the 5th week. C, development of pronephric tubule starts at the caudal end of the nephrogenic cord and progresses cranially. D, forms vestigial excretory units called nephrotons that regress before more cranial ones are formed.
Okay, so here true is, I think the development of the pronephric tubules start at the caudal. Sorry, no, that is wrong. The second one is true. Second option. First seen at the late 3rd week and it will completely degenerate by 5th week.
So this starts in the cervical region. I think the first answer is wrong because it is thoracic.
Yes.
And third answer is because it starts from the cranial caudal.
Cranial to caudal, yes.
The vestigial spelling is wrong.
Vestigial, sorry sir. Vestigial.
Respiratory units called. Okay. Okay. You have any theory or we are going ahead to the next? Okay. Yeah, you can go through this. Priyanku.
Yes, sir. So the pronephros is a transitory non-functional kidney which is first seen late in the 3rd week. It completely degenerates by the start of the 5th week. That it develops as 7 to 10 solid cell groups in the cervical region. That is why the first option is wrong, which was mentioned as thoracic region. Development of pronephric tubule starts at the cranial end of the nephrogenic cord and in the form of vestigial excretory units and progresses caudally. So again, the option C is wrong. As its tubule matures, it immediately begins to degenerate along with the segment of the nephric duct to which the tubules are attached. So actually D is also wrong because cranial worms are formed initially actually, then the caudal ones. So the regression is also from cranial to caudally. So the option B is only correct in these questions.
Who else is there in NUS?
No, I am alone, sir. Transplant is there, so there's two people.
Okay. Right. Puttaparthi, anybody? No. Okay, Dr. Kamal? No, he will read it and then you can tell us.
Yeah. Question number 2. Which of the following is true about mesonephros? The mesonephros and the mesonephric ducts are derived from the intermediate mesoderm from the cervical to upper thoracic segments. That is option A. Option B, it occurs early in the 4th week of development. Option C, the tubules enter the mesonephric duct medially. Option D, development of the mesonephric or Wolffian ducts follows the development of the mesonephric tubules.
The first option is incorrect because it is at the thoracolumbar region. And B is correct because it starts from the 4th week and the it starts the 5th week. This is also wrong. Then tubules enter the mesonephric duct medially. That seems correct. And the D development of Wolffian duct follows the development of mesonephric duct tubules. No, it is wrong. First tubules will form, then the duct.
No, it's
C.
Yeah, there is a doubt between C and D. Priyanku?
Sir, answer is actually BS. I have got it occurs early in the 4th week of development. C is wrong because the tubules enter the duct laterally, not medially.
laterally.
And D is wrong because development of the mesonephric ducts precedes the development of mesonephric tubules, as per the explanation. So mesonephros is a transient organ once again. Both the mesonephros and the ducts are derived from the intermediate mesoderm from the upper thoracic to upper lumbar segments. It serves as an excretory organ for the embryo while the metanephros begins its development. Mesonephric ducts precedes the development of the mesonephric tubules. After the appearance of the mesonephric ducts during the 4th week, so that is the 4th week is the correct. Differentiation progresses craniocaudally and results in formation of 40 to 42 pairs of tubules. Cranially located tubules start to degenerate at about the 5th week. So, next slide, I have some more information.
Medial lateral, what is it? Tubule center, is it lateral?
Lateral, sir.
Ved Naikam, anybody has joined in?
Yeah, I've joined. It's just that there's some problem with the computer. I'm coming on my phone.
Okay.
Can you hear me?
Yes, sir. Morning.
There is a little bit of discrepancy in this development. Some people say 4th week, some people say 5th week. I think both can be accepted, frankly. There are some books say 5th week and some books say 4th week. But it's important because these things are very well timed, you know. And yeah, I found sometimes some glaring mistakes in some books. Yesterday only I found another glaring mistake in another book. So I'm not sure what.
It is
This is a
from Langman. It is given 4th week of development.
Yeah, sure.
Yeah, you want to go through this, Priyanku?
Yeah, I can just go through it, some part. Mesonephros, it disappears almost completely by the 4th month. Certain elements are retained as part of this tract. In males, epididymis and vas deferens are formed from the mesonephric ducts or Wolffian ducts. Cranial mesonephric tubules become the efferent ductules of the testis. That is on the cranial side. In females, the remnants of cranial and caudal mesonephric tubules form small, non-functional mesosalpingeal structures. These are called the epiphoron and paraophoron, and the Gartner's ducts in the vaginal vestibule. Mesonephric tubules differentiate into excretory unit that resembles an abbreviated version of an adult nephron. Going to question number 3.
Dr. Santosh here. Sandeep, sorry. What? Nephrogenesis is completed before birth by which week?
Which? There are 4 options: 28 to 30 weeks, 30 to 32, 32, 34, and 34, 36.
So here answer is D, 34 to 36 week. Kidney completion. All nephron developed. But D is the answer.
I think the option I have given wrong. It is answer will be C, 32 to 34 weeks. I have given in the explanation. So just a few description about metanephros. So it is the ultimate definitive kidney which forms in the sacral region. It is formed when there is sprouting of ureteric buds from the distal portion of mesonephric duct. And these come in contact with the blastema of the metanephric mesenchyme, which happens at around the 28th day. The ureteric bud penetrates a condensing metanephric mesenchyme, and there is continuous division, dichotomous division, which will exert some inductive effects on the overall system and resulting in formation of the nephrons. So nephrogenesis entire process is completed before gestation and before birth by around 32 to 34 weeks of gestation. So I have put some points regarding the development of the nephron, the development of excretory system and the collecting system in the next slides. So here you can see in this slide. So this is the ureteric bud which develops, and there is a mesenchymal condensation. So initially there is a formation of a renal vesicle from the tubularization of the epithelial component. So gradually this renal vesicle as shown in the picture, it will alter in its shape. First it becomes a coma shape, then it becomes an S shape. Gradually it elongates, and one end of the tubule gets attached to the ureteric bud, and the distal end, other end will form capping and accordingly go on to form the Bowman's capsule. So the nephron, glomerulus, amongst the nephron, the glomerulus, proximal tubule, loop of Henle and distal tubule, all these structures are thought to derive from the metanephric mesenchyme. While the collecting system, which constitutes the collecting ducts, calyces, pelvis, and ureter, they are from the ureteric bud. Older and more differentiated nephrons are located in the inner part of the kidney near the juxtamedullary region, while newer and less differentiated nephrons are found in the periphery. So in the next slide, a few points about the development of this collecting system. This developed from the ureteric bud as mentioned before. So the bifurcation of the bud is the main thing which determines the eventual pelvic-calyceal patterns and their corresponding lobules. Initial few divisions will give rise to the renal pelvis, then follows by the calyces, major calyces, followed by the minor calyces, and ultimately collecting ducts. By the 6th week, the ureteric bud will bifurcate at least 4 times, and by 7th week, more further generations of branches will form, giving rise to minor calyces. And by the 32nd week, approximately 11 additional generations of bifurcation will occur. This will result in formation of 1 to 3 million branches, all of which will become the collecting duct tubules. So this is in brief the formation of the collecting duct system.
Yeah, somebody in Vednaikam has joined in?
Yes, sir.
Yeah, you can take this question. Priyanku?
Yes. Question number 4. Urine production begins soon after the differentiation of the glomerular capillaries, which start to form by which time? 6th week, 10th week, 12th week, or 14th week?
By the 10th week.
Yes. It's B answer, by the 10th week. So it is seen that the urine formation by the metanephric kidney begins immediately after differentiation of the glomerular capillaries, and this happens around the 10th week of gestation. Once this urine formation starts, it is seen to continue throughout fetal life. It is important to note that the production of amniotic fluid is predominantly accomplished by this fetal urine excretion. Once the fetus grows, it is approximately 300 ml per kg fetal per day, and almost at around term it will.
Your voice is breaking and we can't hear you now.
Hello?
I think, now I can hear you.
Yeah.
So now going back, it was 10th week from the metanephric kidney. What about the mesonephric kidney? It doesn't produce urine?
Yes, it produces.
Sir, I'd like to add the urine production is by 5 or 6 weeks by Mesonephros, but the ureteric bud which fuses to the bladder by day 37. And bladder filling we can see by 9th and 10th week. Yeah. Bladder when we see 10th week, 9th or 10th week. And the fusion of the ureteric bud with the bladder is by 37th day.
Next.
Yes.
And it is said at 36 weeks, 1 liter of amniotic fluid is there normally. Yeah.
Karunakar, next question. Priyanku can go to.
Yes. kidneys ascend to the upper lumbar region 5th week to 9th weeks, 6 to 9th weeks, 7 to 9th week.
Maybe around C or D, sir. 6 to 9 or 7 to 9, approximately that around 8 to 9 weeks, I remember. So I don't know exactly C or D. I go for C, 6 to 9 weeks.
Yes, answer is C, 6 to 9 weeks. So that is the duration when the kidneys are seen to ascend to a lumbar side and settle just below the adrenals. The precise mechanism is not exactly known. However, it is speculated that there is differential growth of the lumbar and sacral regions of the embryo, which plays a role. As the kidneys start migrating relatively, they are vascularized by succession of transient aortic sprouts, and these will arise at progress sequentially from lower to higher levels. Final pair will form in the upper lumbar region and becomes the definitive renal arteries. So in case any inferior polar vessels they persist, they will remain as accessory lower pole arteries. Question number 6. The fused lower pole of
9. Yeah, Doc 9.
First answer, first A, sir. Inferior mesenteric artery.
Can I make a statement here?
Sir,
There is one book which says it is superior mesenteric artery. There is one book which says superior mesenteric artery. I can give you the reference.
so your audio is not clear.
Can you hear me now?
Yes, sir.
So one of the books says superior mesenteric artery. You're all taught it's inferior mesenteric artery, but one of the books says superior.
Both of these arteries are anterior branch. So since inferior mesenteric artery is at the level of lower border of L2 and or upper border L3, more chances the ascent will be arrested at this artery, because SMA origin is little above at L1 L2 junction.
My reference is Blandy Urology, the latest edition. That's why I was a little surprised.
Okay, we'll see what Priyanka has to say.
When I looked at it rationally, the kidneys are ascended by about the 9th week. The fusion takes place at that point, between 6th and 9th week. And it has to be arrested at that point, and it must be the superior mesenteric artery which is sitting there. The kidneys are at a lower position in horseshoe, but they're still in the lumbar region, isn't it? When you do PCR and all, you are still got the upper pole axis.
okay.
So I don't know, we need to check this out.
Okay.
Priyanka, you tell us.
Yeah. So when there is a failure of the proper ascent of the kidneys, there is it results in ectopic location. If there is complete failure of the ascent, it remains in a pelvic position. The inferior poles of the kidneys may fuse. This will lead to form horseshoe kidneys, and this fusion will cross anterior or ventral to the aorta. Incidence is seen to be around 1 out of 500. During ascent, this fused lower pole is arrested by the inferior mesenteric artery as given in Campbell, and thus it does not reach the normal side. Typically, these abnormalities do not cause any significant symptoms. However, there is slight increase in evidence or prevalence of uretero-pelvic junction obstruction, and sometimes also renal calculus disease. So, as given in Campbell, sir, I have mentioned it as inferior mesenteric artery.
No, you're absolutely right. I mean, everybody says it's inferior mesenteric artery. So it means that in the adult,
Yes, sir.
the kidney should be at the level of the inferior mesenteric artery. Isn't it?
Especially the isthmus, when you are looking at the
So,
isthmus.
where is the isthmus? No, if it is inferior mesenteric artery,
Yes.
then it should be well below, isn't it? At the level of
L to L2.
yeah. No, even lower.
Below.
Yeah.
Below. Yeah. Below
So,
that.
where are the kidneys in the adult? Where are the kidneys in the adult?
T12 to L2, sir.
Huh?
T12 to L2, sir.
No, where is the kidney? The upper, if you are saying that to access the stone in the upper pole, to access the stone in the pelvis, everybody does a upper pole puncture because that's most convenient. Lower poles are all laterally deviated.
Yes, sir.
So if it is the upper pole of the kidney, it should be, usually you go through the supra 11, supra 10, supra 12 also.
Yes.
You go through the erector spinae. Erector spinae. This has to be confirmed by something else also.
Okay.
I mean, I'm just looking at it logically, that's all. There's no.
Sir, there has been described that it is like since it is fused U-shaped, 90% the upper pole will be high, the isthmus will be at level of L4, and 5 to 10% kidneys it can be L-shaped or it could be symmetrical kidneys with fibrous isthmus.
Here is brother.
I'll write a letter to the editor of Bladder, to the telephone. Let's see how it goes. Go back and check it out again.
Dr. Praveen.
Okay.
Yeah, Priyanku, you can read.
Yes. Next question is which of the, all of the following are true about bladder development except urorectal septum separates the cloaca into dorsal anorectal canal and ventral urogenital septum and ventral urogenital canal around the 5th to 6th weeks. Option rectal septum anomalies leads to anorectal malformations. Option C is vesicourethral canal gives rise to bladder and pelvic urethra. Option D, caudal urogenital sinus forms the phallic urethra for males and distal vaginal vestibule for females.
So vesicourethral canal gives rise to bladder and pelvic urethra. So.
One of is it, all are true except.
False. We have to find a false statement.
Option
D.
D.
They want all are true except one.
Except D.
Yes, B is the false statement. It is the cloacal anomalies which lead to anorectal malformations and not urogenital.
Alec tubercle is the one that leads to the development of the phallus.
So briefly about bladder and ureter development. Around the 4th week, the neural tube and the tail grow dorsally and caudally, which projects itself over the cloacal membrane. Around the 5th to 6th weeks, this cloaca will partition into an anterior urogenital sinus and a posterior anorectal canal. This partition occurs when there is fusion of two lateral ridges of the cloacal wall and by a descending urorectal septum. So further in next slide. So formation of the urogenital sinus here, the mesonephric duct will fuse with the cloaca by the 24th day, and this will remain with the urogenital sinus during cloacal separation. We can see that there is an entrance of the mesonephric duct into a primitive urogenital sinus, and this will prove to be a landmark which will distinguish the cephalad vesicourethral canal and the caudal urogenital sinus. The vesico-urethral canal will give rise to bladder and pelvic urethra, and the caudal urogenital sinus will form the phallic urethra for males and distal vaginal vestibule in females. So, and briefly about the formation of trigon, I have mentioned in the next slide. With some diagrams, yeah. So here you can see in these diagrams that the common excretory ducts, which is the portion of the mesonephric duct distal to the origin of the ureteric duct. So you can see in the diagram the common excretory duct. They dilate gradually and become absorbed into the urogenital sinus. Both the right and left common excretory ducts will gradually fuse in the midline, and this will form primitive trigon. The orifices, both the ureteric orifices will extrophy and evaginate into the bladder. And this will slowly begin to develop in a cranial and lateral direction. As in the diagram, you can see the yellow part. This is moving in the cranial and lateral direction within the floor of the bladder. During this process, the nephric duct orifice will diverge away from the ureteric orifice and migrate caudally, touching the paramesonephric duct at the level of the urogenital sinus. So this will be the site where there will be formation of future verumontanum in males and vaginal canal in females.
In New South, I have a suggestion. Can you make him co-host so that he can use the mouse and pen? It will be easier for people to follow.
Yes.
Yes, sir.
Actually, I'm doing from mobile, so probably that may be a problem. I think from the next time onwards, we have to follow this, sir.
Now you are a co-host, you can try.
So I'm doing from mobile screen, sir. That is why I may find some difficulty.
Okay.
Next time I will discuss it. Prior discussion and have to be done like that, I think. Okay, sir. Next question. Which of the following is true about Weygard-Meyer's rule? Option A: upper pole ureteric orifice rotates posteriorly relative to the lower pole orifice and assumes a more caudal and lateral position. Option B is upper pole ureteric orifice may result from ureteric bud arising too high on the mesonephric duct. Option C: lower pole ureteric orifice assumes a more medial position. Option D is lower pole ureteric orifice may result from ureteric bud arising high on the mesonephric duct.
Yeah. Too high. Yeah. Lower is rising high on the mesonephric. D is correct. Pranku, D is correct?
Yes. No, B answer. B will be correct.
D only. B is correct.
Lower pole results rising low on the mesonephric duct, not high.
Lower is high. See, lower is high. Low is high.
Lower pole that reflux. Yeah. Raising the not observe.
Lower is high, no?
YT which refluxes has a ureter which is more lateral.
So let's look at the explanations. Here we see that wrong.
It looks like higher. No? That's why it is more cranially, no?
Yeah, you have to work that. There's a confusion between B and D.
In lower pole orifice, it results from the ureteric bud arising too low on the mesonephric. Means on the mesonephric that it rises too low. That's why the abnormality occurs. And it assumes a more lateral position in case of lower pole.
Yeah, that's because the trigon is already formed by the absorption. parts of the ureteric septum, so it has to be.
So in the explanation, so upper ureteric orifice rotates.
I think your internet is little slow. Your voice is sometimes breaking.
Posteriorly related to the lower pole, assumes a more caudal and medial position, flicked up, draining at the office. Hello. Hello. Hello.
Priyanka, you can change the slide?
Yeah, I can see the slide. I can hear also.
Change.
Yeah. Yes, you can change the slide.
Lower pole arises too.
So the occurrence of vesico-ureteric reflux is because of an inadequate intramural tunnel in this case. Since the ureteric, since it arises too low on the mesonephric duct, as Sir has already said, it will cause premature incorporation and migration within the developing bladder. So that is why it will assume a more lateral and lateral position and lower. Next question.
Yeah, Dr. Sandeep, you will take this.
Involution of the uricus involutes to become a fibrous cord, resulting in median umbilical ligament, at which A 11 weeks, B 12, C 13 weeks, and D 14 weeks.
D.
His answer is B 12 weeks. We can see in the next slide. So these are some milestones in development of the bladder and continence mechanisms. So we see that around week 7 to 12, the epithelium will seem to consist of a bilayered cuboidal cell, and smooth muscle fibers will begin to appear. In week 10, we see that the bladder forms a cylindrical tube with a single layer of cuboidal cells. There will be tapering of the apex as the uricus, and this will be contiguous with the allantois. Next, by week 12, we see that this uricus will slowly involute and ultimately result in formation of a fibrous cord. This fibrous cord will remain unpersistent as a median umbilical ligament. So week 12, as mentioned in the question. By week 13 to 17, it is seen that ureterium will acquire more mature urothelial characteristics. And by week 21, the urothelial 4 to 5 cell layers thick will form, and this will demonstrate features similar to a fully differentiated urothelium. So from these findings, we can see, we can take the answer from the third point, that is by week 12. So embryologically, bladder is composed of two regions, bladder body and trigon. Bladder body is derived from endodermal line, vesico-urethral canal, and surrounding mesenchyme, while a trigon will develop from the incorporation of the common excretory ducts. It is the portion of the mesonephric ducts which will be distal to the origin of the ureteric bud into the base of the developing bladder.
Parts of the distal portion of the urorectal septum also contribute to the development of the trigon. Not only so that as the urorectal septum gets absorbed, part of it actually goes into the trigon. So
Urorectal septum, okay, sir.
Yes.
We'll note that, sir. Yes. Coming to true about the development of the urethra. Option A. Option A, the epithelium surrounding connective tissue and smooth muscle tissue originates from the splanchnic mesoderm. Prostatic urethral epithelium begins to proliferate by the end of 4th month. The outgrowths penetrate the surrounding mesenchyme, forming prostate gland in males. In females, the caudal part of this urethra gives rise to urethral and paraurethral glands.
The option C would be the correct. The outgrowths penetrate the surrounding mesenchyme and lead to formation of prostatic gland.
Yes, correct answer is C. So if we go through the explanation, we can find it out. So the epithelium of the urethra in both sexes originate in the endoderm. So in the question, it was mentioned while the surrounding connective tissue and smooth muscle tissue is derived from splanchnic mesoderm. So this is the difference. It's not that in the question it was mentioned all the three develops from the splanchnic mesoderm. So the epithelial part develops from the endoderm. Prostatic urethral epithelium begins to proliferate at the end of 3rd month, not the 4th month. So option B is wrong. This forms the number of outgrowths that will penetrate the surrounding mesenchyme, forming buds. And these buds will form prostate gland in males. So that was the option C, which is correct. In females, it is the cranial part which gives rise to urethral and paraurethral glands and not the caudal part. So option D is wrong.
Ravina, next question.
The primordial germ cell migration and the formation of the genital ridges begin at which point of time during gestation? 3rd week, 5th week, 6th week, or 7th week?
5th week of gestation.
No, it's 3rd week.
B is correct, 5th week.
Yeah,
no, so I think from the explanation, I think it will be option A. A will be correct. I have made a mistake probably, sir. The site of the primordial germ cell origin in the wall of the yolk sac in a 3-week-old embryo. However, during the 5th week, these cells will migrate from the yolk sac along the dorsal mesentery to the posterior body wall near the 10th thoracic level. Next, at around the 5th week, next slide, there is migration of primordial germ cells to the posterior body wall near T10, which will signal the Mesonephros and adjacent coelomic epithelium to proliferate. And these will form genital ridges just medial to the developing pronephros. So we can see in the diagram. And the 6th week, there will be the cells of the genital ridge which will invade the mesenchyme in the region of future gonads, and eventually it will form primitive sex cords. The genital ridge mesenchyme containing the primitive sex cords is divided into cortical and medullary regions, and after the 6th week, they will pursue different fates in male and female embryos. So the site of primordial germ cell origin will be in the 3-week-old embryo.
So how do these cells actually go there? Where do they originate from? These genital cells? Where do they originate from?
From the yolk sac, it will come.
Okay, from the yolk sac. How do they then go to the genital ridge? Then they go along the dorsal mesentery. How do they go actually? Which is the most primitive of all cellular structures in the world? In the biology class, they told us the cellular organism. Amoeba, no?
Yes.
These cells move by amoeboid movement. They move by amoeboid movement along the yolk sac from the coelomic cavity along into the coelomic cavity and then reach the dorsal mesentery posteriorly. So it's the amoeboid movement which makes them go there.
Okay, yes. Coming to the next question. All except the following are true about development of prostate. A. Develops from the urethra. B. Driven by testosterone. C. Mesenchyme surrounding the endoderm-derived prostatic acini differentiates into smooth muscle and connective tissue. Prostatic development depends on mesenchymal epithelial interactions, but under the influence of androgens.
Vednaikam, who is there? Residents?
Yes. Prasanna.
Okay. Prasanna?
Harish.
Prasanna.
Yes, often is develops from the urogenital swings.
Yes, urogenital. True development of the prostate. All except one. All are right except one of them. Can the prostate develop from the urethra?
Develops from the urogenital swings.
The prostate has two parts, isn't it? It has a connective, the stromal part and a glandular part. So the two must be different. Stroma always is from mesoderm.
It's actually what, it's from what was meant is actually there are outgrowths from the prostatic urethra, which will penetrate the mesenchyme, forming the prostate gland. So in that sense, it was given as develops from the urethra. Option B, actually, it is driven by dihydrotestosterone. So that is why the incorrect answer is given as driven by testosterone, option B. The C and D options are correct. These outgrowths, mesenchyme surrounding endoderm-derived prostatic acini differentiates. So there are outgrowths from the prostatic urethra, forming buds, which will ultimately give to formation of prostatic stroma. And this is driven by dihydrotestosterone. The development begins around the 10th week as a cluster of endodermal evaginations. Initially, 5 independent groups of solid cords will be formed. By 11th week, these will develop lumens and glandular acini. By 13th week, testosterone rises. Secretory activity will begin from there. Mesenchyme surrounding endoderm-derived prostatic acini differentiates into smooth muscle and connective tissue, which was given as an option. As this, there is development, there will be paired bulbourethral glands sprouting from the urethra just below the prostate. Like renal and bladder development, prostatic development also depends on mesenchymal epithelial interactions, but this is under the influence of androgens.
Are you saying that the whole of the prostate is developed from the urethra?
No, sir.
It can't be. Whole of the prostate cannot develop only from the urethra. Because as I said, it's got two components.
Two components.
The endodermal part will develop into the glandular portion of the prostate, which is from the urethra.
Yes.
The stromal part will not develop from endoderm.
Yes.
The stromal part will develop from the intermediate as mesoderm.
Mesenchymal.
So B is also partly correct because testosterone will lead to dihydrotestosterone. And urethra also, this is partly correct because only the endodermal part will lead to the glandular part. So,
okay, sir. So
you should set the question properly.
Yes, sir. This will be a bit slightly controversial as per the options because they are partially. Okay, sir. I made the questions from these. First, I made the explanatory slides, sir, from basic, and from there I just made the options. So probably So the next question, which of the following is not true about external genitalia development? Option A, early in the 5th week, cloacal folds develop on either side of the membrane, cloacal membrane. The appearance of the external genitalia is similar in male and female embryos until the 8th week. The external genital appearance of males who are deficient in 5-alpha reductase is similar to that in females. In females, urethral folds become the labia majora and the labioscrotal folds become the labia minora. So,
Harish from Mednak.
D, I think.
yes, answer is D, correct. Maybe I have in the slide I have marked it wrong. Answer is D. So urethral folds become the labia minor actually, not the labia majora, and it is a reverse is true. The labioscrotal folds will become the labia majora during the external genitalia development. So option D is wrong here. Other options are correct. Early in the 5th week, there is a pair of swellings called cloacal folds, which will develop on either side of the membrane. These folds will meet anterior to the membrane to form a midline swelling. It will be called the genital tubercle. And the early development of the external genital organ is similar in both the sexes, which is until about 8th week. That option was correct. During the cloacal division into the anterior urogenital sinus and the posterior anorectal canal, the portion of the folds flanking the opening will become the urogenital folds, and the portion flanking the opening of the anorectal canal will become the anal folds. Gradually new pair of swellings are formed called the labioscrotal folds, which appears on either side of the urogenital folds. In the absence of dihydrotestosterone, the primitive perineum does not lengthen and the labioscrotal and urethral folds do not fuse across the midline in the female embryo. So that is why males who are deficient in 5-alpha reductase, it will be again similar to that of females. The phallus bends inferiorly, becoming the clitoris, and the definitive urogenital sinus will become the vestibule of the vagina in females. These urethral folds become the labia minora and the labioscrotal folds become the labia majora. So this was reversed, and that is why the option D was wrong. The external genital organ develops in a similar manner in genetic males who are deficient in 5-alpha reductase and therefore lack dihydrotestosterone. So in absence of 5-alpha reductase, there will be decreased dihydrotestosterone, and that is why there will be similar appearance. That is external genital appearance in males will be similar to that of females.
Kamal here.
So next question here, the testicles descend to the level of internal inguinal ring by which point of gestation? 6th week, 3rd month, 6th month, or 9th month?
As per I have read, it is 7th month. It reaches the deep ring and scrotum by birth or 9th month. So I don't know. You have given 6th month as a correct option. It starts by 3rd month. Reaches
Internal
the
ring. Yeah.
Reaches the deep ring by 7th, scrotum by birth, or you can say 9th month by scrotum. So I'll go for C.
Yeah, it reaches through the inguinal canal to the scrotum between the 7th and 9th, but it reaches the level of the internal ring by 3rd month. So both the testes and ovaries, they descend from its original position, which is originally near the 10th thoracic level. Gubernaculum is necessary for initial descent of the gonads. That is why fetal testicle descends to the scrotum, while the ovary does not. It is initially formed during the 7th week, that is before the 2nd month. Superior end of this is attached to the gonad, and expanded inferior end is attached to the fascia between the developing external internal oblique muscles in the region of the labioscrotal folds. So in case of female, next slide, we can see that the processus vaginalis forms at the same time as the gubernaculum, where there is slight evagination of the peritoneum developing adjacent to the bulb. Normally it degenerates, but occasionally it may remain patent. So this is the result in some infants result having either communicating hydrocele or indirect inguinal hernia. In the inguinal canal, there is caudal evagination of the abdominal wall. This will form when the processus vaginalis expands inferiorly. There will be evagination through these abdominal wall layers. So the three layers will be picked up sequentially. The first layer encountered is the fascia transversalis, lies just deep to the transverse abdominis. Next, it picks up the internal oblique. So eventually it becomes the cremasteric muscle of the cord. And finally, it will pick up the external oblique, which will become the external spermatic fascia. In males, the inguinal canal extends down to the scrotum and allows passage of the descending testicle. However, in females, there is a complete inguinal canal formed, but appears to play no role in the eventual genital development process. So, next slide, please. So, three phases of descent are seen in testicular descent: transabdominal, transinguinal, and extracanalicular. Relative growth of the lumbar vertebral column is the remain is suspected to be responsible for intra-abdominal descent, as position is relatively fixed by the gubernaculum anchoring near the inguinal canal. This will remain near the internal inguinal ring from the 3rd month to up to the 7th month. So that is why the answer is given as 3rd month. So from the 7th month onwards and later, it will pass through the inguinal canal, that is between 7 to 8 months, in response to renewed shortening of the gubernaculums. This transinguinal transit or phase appears to be a repeat process within 1 month, and it will probably occur within a few days. Once they pass through the inguinal canal, the testicles remain in the subserosal fascia, through which they descend towards the scrotum. Further descent once outside the external inguinal ring, that is extracanalicular, to dependent portion may take around 4 to 6 weeks. By 9 months, almost both the testicles have completely entered the scrotal sac. The gubernaculum will remain a small ligamentous band attaching inferior pole of the testis to the scrotal fold. Briefly, the mechanism, genetic mechanism is also described in the next slides in short. So, the undifferentiated gonad, which is seen actually, it is initially located high in the abdomen and is anchored by a cranial suspensory ligament. In males, this Leydig cell gene product will cause swelling and enlargement of the gubernaculum, which will pull the developing testicle towards the inguinal region. And androgens will cause involution of the cranial suspensory ligament. Here, there is an action of the Mullerian inhibiting substance, whereby the Mullerian duct will regress, while androgens will continue to stimulate the development of Wolffian ducts into male genital ductal structures. However, in females, the cranial suspensory ligament will persist. This persistence occurs because of absence of androgens, and the gubernaculum will remain thin because of the absence of ISL3 activity. That is why this pulling towards the lower part is not seen, and the ovary will be kept well within the pelvis. That is why there is no descent of the ovary like the male's testicular descent. Coming to the last question, an important question regarding the derivatives. So, which of the following is not a derivative of Wolffian duct? Appendix of epididymis, ductus deferens, appendix of testis, or ejaculatory duct?
Sir, appendix of testis is wrong. It's not a part of Wolffian duct. It's a part of Mullerian duct.
Yes. Easy, but often it is a confusing thing. So, appendix of the testis is developed is a derivative of the paramesonephric or Mullerian duct. Actually, so this is a chart taken from Campbell. So, different derivatives from embryonic structure in males and females are shown. If we go through this chart, we can have a good idea of all these derivatives. So here in this chart, we can see the appendix of testis, which is seen to develop from the Mullerian duct, while the other components which were mentioned in the question in the fourth line, column in the fourth appendix of epididymis, ductus deferens, ejaculatory duct and seminal vesicles, ureter, pelvis, calyces, and collecting tubules. In the males, all these develop from the Wolffian duct. However, in females, there is a remnant of this mesonephric duct, only the Gartner's duct, and ureter, pelvis, the urogenital system, collecting system will develop from the mesonephric duct in both males and females. The remnant derivative will be the Gartner duct in the anterior superior vaginal wall. So likewise, if we go through this entire chart, we can see the different structures in males and females with different originates from different embryonic structures.
Priyanka, you finished in proper time.
Yes, sir. So I was thinking of the time frame, sir, because I had some more topics, but the explanation and slides will go on increasing. That's why I limited up to these 15 questions, sir.
Good. I think covered most of the embryology well. The topic which is not
two
usually...
questions. Yeah. I think there were a few answers were a bit confusing, but I think that will help us, sir, later on.
I have one thing to suggest, Priyanku.
Sir?
And to the slide set that's going to be made. There are very nice three-dimensional illustrations available from Netter and other sources. If you can find them, you can build up a nice slide set where you will be spared the trouble of explaining in words. Just looking at the image, diagram, you can make out what's going on. Okay?
Okay, sir.
But this is a good job. Well done.
Thank you, sir.
Ganesh, sir, anything? Yes, sir.
Go and check back on some. The embryology is the books are, they do make some differences depending on which you read. So.
Okay, sir. Thank you, sir.
Thank you, sir. Thank you, sir.